I'm Kelly Warner. Did you know that colon cancer can be prevented through screening or caught early when treatment works best? Unfortunately, about a third of Americans are not getting the recommended testing, and there's been a concerning increase in the number of people under 50 being diagnosed.
As a gastroenterologist, Dr. Jubin Movin knows the importance of preventative screenings for colon cancer.
Hi, Mr. Smith. How are you?
As the head of the COVID task force at the Oregon Endoscopy Center, he's helped implement additional safety protocols to encourage more people to see their doctor when they should. Those protocols include social distancing measures, temperature checks, required COVID testing for patients prior to procedures, and providing more patient appointments through telemedicine.
The patient is really at the center of what we do, and ultimately their safety and optimal outcome is what drives us.
Since the health crisis began, fewer people are scheduling colonoscopies and other preventative screenings. Doctors worry that delaying those important procedures may put people at risk.
These polyps tend to take about 5 or 6 or 8 years to turn into a malignancy or a tumor. And so that may very well be an unintended late-term consequence of the decreased level of interaction between patients and healthcare providers.
It's estimated that about 1 in 20 people will develop colon cancer in their lifetime. About 150,000 are diagnosed with colon cancer each year in the U.S. And over the last 10 to 15 years, there has been an increase in the number of younger people getting colon cancer. While no one can say for sure why that is, Dr. Nathan Holman says it's believed poor diet, a sedentary lifestyle, and obesity play a role.
35–40% of our country is obese. Fat has been shown to sort of change the hormonal environment in your body, and that certainly can promote cancer cells to grow. Fat can also sort of lead to some systemic inflammation, which can encourage tumor growth.
Colonoscopy is recommended starting at age 50 or younger if you have a family history.
But certainly if you have any sort of alarm symptoms, like you're starting to see some blood in your stool, or you're starting to get anemic or things like this, by all means, it's worth talking about with your doctor, because that is something that we sort of need to be on the watch for.
How colon cancer is treated depends on how early the cancer is caught. Learn more about colon cancer symptoms and cancer care in the community at OregonCancerAlliance.com. I'm Kelly Warner.